Public health in the 18th and 19th centuries in Britain. The 18th century in Britain was a period of significant urban development with the growth of cities and towns and the expansion of industry and trade. This period also saw the emergence of more public health improvements due to concerns by the government and public brought about through rapid urbanization and industrialization, which caused a large health strain and increased diseases and problems. The 18th century was a time of significant growth, driven by the expansion of industry and trade. The most significant cities, such as London, Birmingham, Manchester, and Liverpool, grew rapidly, attracting migrants from the countryside and abroad. The population of London grew from 700,000 in 1750 to over 1 million in 1800. One of the main factors which contributed to the rapid urban development was the change in the societal way of life from rural to urban, led by the emergence of factories and industrialization. For the most part of the 18th century, Britain was a rural society, with small workshops in home making it a cottage industry. Enclosure Acts, crop rotation, and improvements in irrigation meant that a positive cycle of agricultural production was created on farms, and this meant that the population grew, leaving a surplus of manpower in rural areas. This caused unemployment, so made people from rural areas begin to move to cities to look for work. A rapid move to cities meant that they were overpopulated, and living in houses that had been thrown together quickly meant it was unsafe, polluted, and unsanitary. These changes meant that people's way of living and working patterns were drastically changed by urbanization. The nature of urban development also meant that both the public and the government began to look at public health very differently and how the government could deal with it. By the end of the 18th century, around 1/4 of the British population lived in towns and cities, and the speed at which this was happening meant that town planners failed at effectively organising the town. This meant that many buildings were built very quickly and unsafely, resulting in small, cramped slums where diseases spread easily. More people moving to towns meant more rubbish with less space for it to go, and this became an even bigger problem further into the 18th century. The mayor would reply to housekeepers to keep streets clean and would impose fines if this was not carried out. Municipal governments were also created, which were responsible for managing public services such as water supply, sanitation, and law enforcement. The Bow Street Runners were a group of law enforcement officers who were active in London around the 18th century. They were responsible for investigating and apprehending criminals in the city. The Bow Street Runners were highly effective in their work, and they played a significant role in the development of modern policing in Britain. The growth of cities and towns during the 18th century brought about new challenges to public health, as sanitation and disease control became major concerns for policymakers and public officials. The high population density of urban areas made them particularly susceptible to outbreaks of infectious diseases such as smallpox, typhus, and cholera. Towards the end of the 18th century, Edward Jenner used cowpox as a form of immunization, which began the breakthrough in terms of treating diseases and preventing them. Modern hospitals also began to appear in the 18th century. They had trained surgeons but untrained workers. Separate departments for treating different patients began to be established, and an understanding between medicine and poor relief. St. George's Hospital was founded in 1733 and was one of the first hospitals to have a resident medical staff. However, conditions in hospitals were still very poor. It was overcrowded, unsanitary, and poorly ventilated. Patients were often treated harshly or neglected because hospitals were often associated with poverty. Hygiene was still regarded as not important, as people did not know that bad hygiene spread disease. Surgical instruments were not properly sterilized, and patients with contagious diseases were not isolated from others, which allowed diseases to spread rapidly through hospital wards. In conclusion, the 18th century in Britain saw significant urban development and expansion of industry and trade, leading to the growth of major cities and towns such as London, Birmingham, Manchester, and Liverpool. However, this rapid urbanization caused significant health challenges, with the spread of infectious diseases due to unsanitary living conditions, overcrowding, and poor hygiene in hospitals. The government and public officials responded to these challenges by introducing new public health regulations and the emergence of modern hospitals. While the 18th century in Britain marked a period of significant progress, it highlights the importance of considering public health implications and urban development. Into the 18th and 19th century, the rapid rate of urbanization amplified the simultaneous growth of disease and a growing death rate. After the 1838 typhoid epidemic, Edwin Chadwick released a report in 1842 which argued that diseases were directly linked to poor living situations and therefore drastic improvements needed to be taken to reform public health. Friedrich Engels' The Condition of the Working Class in England, 1845, provides a broad analysis of the social and economic conditions that contributed to public health problems in the 19th century. He describes the lack of overcrowding, lack of sanitation, and high rates of disease and mortality that were prevalent in cities such as Manchester and Liverpool. He stated that about 1,200 in 10,000 adults died before reaching the age of 39. Joseph Dare's annual reports for the Leicester Domestic Mission provide a detailed account of the living conditions of the poor in Leicester during the mid-19th century. These reports describe the overcrowded and unsanitary housing conditions that were common in the city, as well as high rates of disease and mortality that resulted from these conditions. These reports and books provide valuable insights into the realities of life for the poor during this time period and highlight the ways in which public health problems were shaped by social and economic factors. It shows how the causes of public health problems were because of the overcrowding in cities due to industrialization and how people began to realize this in the 19th century. In the 19th century, urban development and pollution of the air were major contributing factors to public health problems. Industrialization during this period brought about significant changes in urban areas. The burning of coal and fossil fuels released harmful pollutants such as sulfur dioxide into the air. In 1880, Francis Albert Rollo Russell published a significant release that drew attention to the health effects of sulfurous smoke on respiratory diseases like bronchitis. Russell's leaflet played a crucial role in raising awareness about the harmful impact of air pollution on public health during the 19th century. He stated that more than 2,000 Londoners had literally choked to death. The British government passed several acts to address these challenges and improve public health conditions. The Improvement Clauses Act of 1847 provided a legal framework for improving the living conditions of the urban population and preventing the spread of diseases associated with unsanitary environments. It also contained a section which dealt with factory smoke. The Sanitary Act of 1866 also appointed sanitary authorities who took action on smoke nuisances. The Public Health Act of 1875 contained a section on smoke, on which modern-day legislation is still based on. These public health problems associated with smoke and polluted air prompted increased awareness and an understanding between air pollution and respiratory diseases during the 19th century. The effect of this was the recognition of the government that they needed to improve public health in the form of acts to combat the public health problems caused by polluted air and promote healthier living conditions. Cholera was an unescapable disease in dirty and crowded 19th century cities. There was a huge cholera outbreak in 1831 and it gained the nickname King Cholera. Cholera continued to spread in large cities such as London in the 1850s until John Snow researched the cause and discovered that it was spread through dirty communal water from a pump. Inadequate sewage disposal and the use of contaminated water for drinking and cooking contributed to the spread of the disease. This disease had high mortality rates, particularly in urban areas with poor sanitation and limited access to clean water. This meant that the government began to construct sewer systems and clean water supplies, and the enforcement of hygiene factors played a significant role in reducing the incidence of cholera and improving public health conditions in the 1850s. In conclusion, the causes and effects of public health problems in the 19th century were shaped by various factors, including rapid urban development, inadequate sanitation, overcrowding, and limited medical knowledge. These factors contributed to the spread of diseases such as cholera and had significant effects on public health. However, the challenges also stimulated crucial advancements in public health practices and the enactment of legislation to improve living conditions and mitigate the impact of diseases. In the 19th century, philanthropy significantly addressed public health problems, and individuals like George Cadbury and Joseph Rowntree made notable contributions. Their effects focused on improving living conditions, promoting social reforms, and addressing health disparities among the working class. George Cadbury was concerned about the health and welfare of his workers. In the late 19th century, he built the Bournville Village near his chocolate factory in Birmingham, England. The village provided affordable housing with green spaces. These initiatives aimed to address public health problems by creating a healthier and more supportive environment for the workers. Joseph Rowntree conducted research on poverty and its impact on health in his book, Poverty, A Study of Town Life, from 1901. Rowntree also established the Joseph Rowntree Trust. The trust founded various initiatives related to public health, including research on sanitation, housing, and nutrition. The impact of philanthropic initiatives led by Cadbury and Rowntree and others was significant. By addressing poverty and inadequate housing, these philanthropists contributed to the overall well-being of communities. In the 19th century, government involvement in public health also became increasingly significant as they recognized the need to address these issues through legislation, regulation, and the establishment of public health institutions. In 1842, Edwin Chadwick wrote the Chadwick Report, which linked the lack of sanitation with the spread of disease, high death rates, and low life expectancy. This report led the government to create the Public Health Act of 1848. It granted powers to establish local boards of health responsible for sanitary measures, clean water supply, sewage systems, and the prevention of diseases. However, a negative aspect was that this implementation varied across different areas, and some local boards lacked the resources to expertly and effectively carry out their responsibilities. The Sanitary Act of 1866 further expanded the powers of local authorities in addressing public health issues. This act emphasized the importance of cleanliness and disease prevention measures in communities. It stated that every town had to appoint a sanitary inspector to remove nuisances. However, enforcement varied across different areas still due to resource constraints and variations in local commitment. The Public Health Act 1875 aimed to consolidate and extend previous public health legislation, providing a comprehensive framework for addressing public health problems. The impact of the Public Health 1875 Act was significant in several areas. Firstly, it improved sanitation and hygiene by empowering authorities to enforce regulations related to clean water, drainage, sewage systems, and waste management. These measurements led to a reduction in infectious diseases, improved living conditions, and better overall public health outcomes. Secondly, the Act addressed housing conditions by empowering local authorities to take action against uncrowded, unsanitary, and unfit dwellings. Local authorities were empowered to implement measures to control infectious diseases spread, such as isolation and quarantine. It also established local boards of health and provided guidance on their functions and responsibilities. However, this act still had limitations because it was hard to implement the same procedures across different areas with different authorities. Affordability of good quality housing for the working class also remained difficult. The Infectious Disease Notification Act of 1889 stated that houses and doctors had to report infectious diseases to local sanitary authorities such as cholera, smallpox, and typhus. This helped when knowing when and where outbreaks of diseases were, so that they could be controlled. The Artisans' Dwelling Act of 1875 addressed housing conditions for the working class, which led to improved living conditions and removing unhealthy dwellings. The Gilberts Act of 1782 improved workhouse conditions and expanded types of poor relief, such as improvements in infrastructure and care provisions. The Factories Act of 1833 was concerned with labour conditions, but it indirectly addressed public health issues. The Act regulated working hours, sanitation, and safety measures in factories, thereby improving the health and well-being of workers. However, the Act initially had limited coverage and excluded certain industries, leaving some workers unprotected. The Poor Law of 1834 aimed to reform relief provisions for the poor. Positives included a centralized and standardized system of relief, focusing on workhouse-based provision. However, the workhouses had harsh conditions, and many people did not want to be sent there. All of the legislative measures had a profound impact on public health during the 19th century. They led to improvements in sanitation, housing conditions, disease prevention, and the overall well-being of the population. They showed how the government was beginning to understand the importance of public health and how they were trying to make it better for communities. However, there were still limitations to the effectiveness of each act that was passed. Success was often dependent on local commitment and resources. Public health problems were also addressed through scientific discoveries by certain individuals, which led to improvements in medical care and understanding. Louis Pasteur, a French scientist, published a paper on germ theory in 1861, proving the link between germs and diseases. He discovered that microscopic bacteria could be killed through heating, which was pasteurization. Robert Koch applied Pasteur's theory to human diseases in the late 1870s. In 1875, he discovered the bacteria which caused anthrax, tuberculosis in 1882, and cholera in 1883. He created the science of bacteriology. Ronald Ross discovered in 1897 the cause of malaria through infected mosquitoes and how it spreads, which enabled future scientists to combat the disease. Paul-Louis Simond discovered that the plague was spread through fleas on rats in 1898. This dispelled all other former theories about the cause of disease, such as miasma. Compulsory vaccination for certain diseases, such as cholera, was enforced in Britain in 1851. This was a result of improvements and developments in vaccination due to Edward Jenner's smallpox vaccination in 1796. Another significant figure in 19th century public health was John Snow. Snow's investigation during the 1854 cholera outbreak in London's Soho district challenged the prevailing miasma theory of disease transmission. He mapped cases of cholera and identified a common source, a contaminated water from the Broad Street pump. By convincing authorities to remove the pump handle, Snow stopped the outbreak. Joseph Lister, a British surgeon, introduced the practice of antiseptic surgery in the 19th century. Lister recognized that the high mortality rate associated with surgical procedures was largely due to infections. By using antiseptic techniques, Lister changed medicine forever and reduced mortality rates while teaching people the importance of cleanliness. In conclusion, the 19th century witnessed remarkable advancements in addressing public health problems through scientific discoveries and medical interventions of individuals. These figures revolutionized public health practices and significantly improved disease prevention, diagnosis, and treatment. They improved medical care for years to come, and hospitals still use antiseptics and vaccinations. In conclusion, the 18th century and 19th century had significant changes in public health in Britain due to urban development, the causes and effects of health problems, and the efforts to address them. Public health problems were rife in the 18th century due to rapid urbanization because of the Industrial Revolution, and the move to cities and towns meant that cities became overcrowded, where diseases such as cholera and typhoid fever spread easily. Due to this, the government began to implement various legislation in an attempt to combat severe public health problems, such as various public health acts. Infrastructure was also created, such as better sewage systems and clean water, due to discoveries by individuals such as Edwin Chadwick and John Snow. Discoveries in medicine also meant that improvements could be made in medicine and public health in terms of understanding how diseases were spread and therefore how to prevent them. Philanthropists also helped the government understand the importance of public health in terms of their workers and improving industry and trade. Overall, the developments of this period laid the foundation for subsequent advancements in public health and the pursuit of healthier living conditions for all. Thank you for listening to my presentation.